Welcome to AM Best Audio.
Although net income for AM Best Medical Professional Liability Composite improved in 2024 for the second straight year, the composite reported further deterioration in underwriting results. I'm John Weber for AM Best TV, and here to discuss AM Best annual report on the market segment is David Blades, Associate Director, Industry Research and Analytics. And David, net income is up, but underwriting results are yet again unfavorable. Is there anything that would indicate an underwriting turnaround is possible?
Well, John, for the MPL composite, that AM Best focuses on for this report, and that's for those companies that really focus and the majority of their business is medical professional liability. The underwriting loss in 2024 was half the underwriting loss in 2023. So that's one positive sign from that perspective. But the challenges from the dissipating impact or positive impact from prior year loss reserves, the loss reserve cushion, and also just rising claim severity, that's been very troubling for the MPL companies. They've obviously taken a lot of actions with regards to rate adequacy to try and combat that. In the hospital sector in particular, where loss ratios have been higher, they've definitely made some inroads in that regard, in addition to on the physician segment. But it's been very tough from an underwriting perspective to really overcome some of the challenges that we've seen. On the operating side, as you mentioned, net income, the investment income, based on the really robust capitalization and the sizable asset base of the medical professional liability companies, they've been able to overcome the net underwriting losses. So from that perspective, I think we'll continue to see that. But I think with the sort of wide and varied challenges that we're seeing that the MPL companies have to fight, I think over the near term, we're going to see them continue to fight up against that, and we'll probably continue to see relatively small and hopefully going in the right direction, but relatively smaller net underwriting losses. But I think it's going to take a little bit more time and a little bit more of the underwriting actions, again, pricing adequacy, and also from a risk selection standpoint, fighting against social inflation, some of those other factors, to really see a turnaround, a market turnaround from that.
Customize your data experience. BestLink now offers an interactive company dashboard that provides company-level intelligence in a fast, user-friendly interface featuring interactive tables, charts, and Sparkline performance histories. Customize the dashboard tiles to prioritize the insurer ratings, data, and analytics that best support your workflow. AM Best. Our insight, your advantage.
Perspective.
Now, attacks on tort reform laws have been ramping up. Third-party litigation is still prominent, as are nuclear verdicts. What can MPL insurers do to blunt these impacts?
Well, definitely tort reform challenges and how they affect, costs for MPL companies. That's something that they're very well aware of, and it's something that they're baking into, obviously, their rates and also into their reserves. I think more consistent and more effective advocacy with regards to tort reform in those areas and in those states that are really tough from a jurisdictional standpoint. I think that's what's going to be key, continuing to put those resources in there. I also think from a risk appetite perspective, understanding which are the tougher jurisdictions is probably going to force some companies to make some tough choices in terms of adjusting their risk appetite and seeing where they want to write more of their business, because again, we're seeing more tort reform or erosion of tort reform, and that's definitely problematic for these companies. I think we'll continue to see the advocacy and the resources poured into that and those efforts, not only just from the insurance companies, obviously from the medical professionals, and also from organizations in and around the industry. From the standpoint of kind of fighting social inflation, I think, medical professional liability insurers and their insureds are really trying to focus on more effective risk management. That's, one of the key things in terms of just understanding, the overall risks that are that they're facing from the standpoint of what they can do to help combat social inflation, pouring some, again, some more resources into legal system reform and again, advocacy from that perspective. So I think working hand in hand, the insurance companies and their insureds against these issues, I think they'll continue to try and make strides in that direction. And I think overall, over a long term, that will pay some benefits. But it's an uphill challenge right now.
Are there any other challenges that MPL insurers are facing, David?
Yeah, I think when you think about cybersecurity, for example, and again, it's something throughout the marketplace, but definitely with regards to medical professional liability and just hospitals and physicians, because of the sensitive information and the wealth of information that they gather for their patients, they definitely are always worried about improving cybersecurity. So that's definitely one challenge that we see that they'll continue to battle, and going forward, we'll continue to see how they make strides in that area. Post-COVID, just how the nature of healthcare has changed, the delivery of healthcare, telemedicine. That's another thing where insureds and the insurers have to understand what kind of medical professional liability exposures are coming out of the changing nature of how that coverage is being delivered, or healthcare is being delivered. And I think, the more that they drill down on what needs to be done from a control standpoint, I think we'll continue to see strides in that regard. But again, that's a definite challenge that they're facing. Also, economic inflation and how that's impacting rising costs and claim severity. Social inflation is impactful in that regard. So I think those particular challenges, I think, will continue. We're continuing to see medical professional liability insurers fight against, and also just in the industry, burnout from the standpoint of the actual healthcare providers. I think that's something that can impact patient safety, turnover rates, et cetera, and all of that has an impact on claim frequency and claim severity. So I think those are some of the particular challenges that medical professional liability insurers are dealing with and fighting with. Again, teaming with their insureds to make a better stand against those challenges. And again, I think those efforts over time will have a positive benefit on the medical professional liability industry.
Thanks, David.
No problem, John. Always good to see you.
I was David Blades, Associate Director, Industry Research and Analytics. You can find the full report online at ambest.com. For AM Best TV, I'm John Weber.
Looking to get the full attention of the insurance industry? We have the platforms that will do just that. Whether it be AM Best TV, AM Best Audio, Best Review Magazine, or Best Day. Find out more by calling AM Best Advertising Sales at 908-439-2200, extension 5399, and have a great day.